Hi, my name is Bradley Rate. I'm going to talk to you today about an interesting and lesser known disease called Fibrodysplasia Ossificans Progressiva. This is a disease that stuck out to me because it's one of the strangest diseases that I've ever encountered, and it's one of the ones that is most kind of scary and uncomfortable to me personally to think about. What happens with the disease is that connective tissue will gradually ossify and turn into bone. So your muscles, tendons, ligaments, cartilage can all fuse together and create one solid bony growth. And this can be very debilitating for patients that suffer with it. They lose their independence, they have troubles with activities of daily living. It can be very, very difficult, and it can be a big burden on the family as well. It is especially common in the spine, in the extremities, and even in muscles like the jaw. So if you can imagine sitting on a long airplane ride or car ride and how uncomfortable your body gets after being stuck in the same position for a while. Now imagine if your bones were to fuse together in that position and it was inescapable. You wouldn't be able to move and find a position of comfort. So these people deal with a lot of discomfort in their lives. Chronic pain is a big staple of this illness, and they live in a certain amount of fear of the progression of the disease, of future joints locking up on them and having worsening pain. So the pathophysiology of this disease, for a long time it wasn't known. Initially there were very, very few people in the United States who actually suffered from the disease. And it was commonly misdiagnosed. So it wasn't until very recently that we found out what actually causes this disease. It is a malfunction in the ACVR1 gene, and it's actually a single nucleotide base that is malfunctioning out of 6 billion base pairs. So it's a very, very small mutation to cause such big changes within the body. The earliest sign that this disease is developing is a malformed big toe and first metatarsal in infants. Doctors would commonly look at these bony growths and misdiagnose them as a form of cancer. And this can be especially problematic because any attempt to perform a biopsy or perform a surgical removal of the bony growths leads to inflammation and explosive bone regrowth in the affected area. Any kind of inflammation that these patients experience can cause that explosion of bone growth. So they have to be very careful with any kind of trauma, any kind of bumps and bruises. They really need to watch out. As far as treatment, we are, for the first time in human history, making strides in the treatment of this disease. So as of August of this year, 2023, the FDA has approved the first ever drug for the treatment of FOP. And the way this drug works is it affects the retinoid signaling pathway that is essential for forming healthy bone growth. Another drug that was trialed this year is an anti-inflammatory drug that helps to reduce the instance of bone growth during inflammatory flare-ups. So the idea is, if they're having this inflammation, if they're having some kind of, trauma within the body that is causing the bone growth, we can cut back on the inflammation and we can cut back on the new bone growth that forms. So the impact of this disease. Globally, it impacts about 0.65 per million people in America, which is the highest instance of the disease. In Europe, it impacts about 0.45 per million people. And the lowest rates of occurrence are in Africa at 0.05 per million. So it's fairly uncommon worldwide. Globally, it's estimated that about 2,500 people have the disease. As far as its impact on patients themselves, the quality of life really suffers. It is a gradual, progressive, and debilitating disease. And you can imagine how uncomfortable it must be to have your mobility and your independence stripped away, even your ability to eat food normally, speak. It's really something that's uncomfortable for them. And it's not just hard on them, but it's hard on the families as well. There's a big burden that's placed on the families to be a caretaker as these people lose their activities of daily living. They need more and more in-depth care. They need help with basic daily tasks like getting dressed and using the bathroom. And of course, they're typically unable to hold jobs for themselves as well. So there is a big burden that's placed on the family, and it can be a big strain for everyone involved. The average life expectancy of a person suffering from FOP is about 45 years old. So it really does cut back on the life expectancy as well. So the societal response is pretty interesting. There's one woman named Jeannie Pieper who was diagnosed with the disease at a very young age. She was diagnosed at a time whenever there was not a lot of knowledge about the disease, and there were not many people that were known to be suffering from it in the United States. There were only about 18 people at that time that were known to have FOP. She used money from Social Security checks to start an organization that eventually grew into the International FOP Association. This organization raises $500,000 every year for funding of research on the disease. And it also helps connect patients with other people who have the disease so that they can find community and camaraderie. One other interesting thing is that the global treatment market for FOP is estimated to increase up to $628.4 million by the year 2030. So there is funding out there for the disease, and it's increasing as we learn more about it, as we become more knowledgeable. An interesting side note about the treatment is that scientists who discovered the ACRV1 gene was responsible for FOP hope to use that malfunctioning gene in the treatment of other bone disorders. So there's disorders like osteogenesis imperfecta that lead to very fragile development of bones. And they hope to use the ACVR1 gene in order to stimulate healthy bone growth and bone density. So a couple brief conclusive points is that hope is on the horizon for these patients. As of 2023, we are just now making new breakthroughs in terms of treatment and understanding of the disease. It can be very debilitating for those that have it, and it can be very hard on the families as well. But the new research that's coming out is bringing us closer than ever before to finding effective treatments and finding a cure. In addition to that, studying FOP may prove instrumental in curing not only this disease, but other bone-related disorders as well. So we should really keep our hopes high, keep our sights set on proper research and funding, and take care of those who are suffering from this condition.